So let me start by welcoming everyone to our first webinar on COVID-19 in Latin America. Before we start, I would like to make a few announcements. We have just started a website on COVID-19 in Latin America. So if you go to the ILAS website, you will get a lot of resources, including a podcast with epidemiologist Sylvia Martins, telling us what's going on in the region, the recording of this webinar and the following webinars, a commentary by our faculty and students across the region of what's going on in each of the countries, as well as summary of all the available information on COVID in Latin America from other sources. We have created a resource for everyone who's trying to follow the region. I also want to let you know that the next webinar in this series will be next week on Thursday, April 16, also from 3 to 4. And we will be having Rodrigo Soares, an economist of the School of International and Public Affairs, and María Pilar Fernández, a biologist from Ecology, Evolution, and Environmental Biology, talking about the responses to coronavirus in Latin America, science, expertise, and state capacity. Today, we have the pleasure of starting this webinar series with Manuela Orjuela and José Antonio Ocampo. Manuela Orjuela, who will talk about the epidemiological consequences of COVID-19 in Latin America, is a molecular epidemiologist and pediatric oncologist at the Malman School of Public Health at Columbia. She is the PI for a long-standing NIH-funded study in Central America on the epidemiology of retinoblastoma in collaboration with multiple institutions in Mexico City. And she leads several studies with Mexican and Central American immigrants in New York. Manuela was trained in her natal Colombia. In fact, both of our speakers are Colombians at Columbia. And she was also trained in Chile and Buenos Aires and participates actively in the Latin American Society of Pediatric Oncology. Thank you, Manuela. And we also have with us José Antonio Ocampo, who will talk about the economic consequences of COVID-19. He's a professor at the School of International and Public Affairs at Columbia University, where he directs the Economic and Political Development Concentration. He's also the chair of the UN Committee for Development Policy and the co-president of the Initiative for Policy Dialogue at Columbia University. Previously, José Antonio has served as Minister of Finance, Minister of Agriculture, Chairman of the Board of the Central Bank in Colombia, and he was also the United Nations Under-Secretary General for Economic and Social Affairs and the Executive Secretary of the Economic Commission for Latin America and the Caribbean, ECLAC. So we have, two very good speakers here. I'm going to ask you to use the chat to ask questions because we will need to mute all of you given the recent problems with Zoom bombing. And I will be reading the questions and asking them to them. The first question I gave to them to kind of try to link the two topics is this issue of quarantines, which seems to be social distancing, the way to go with the illness, but also a policy which has tremendous economic costs. So I now leave it to you. Manuela will start first, and then José Antonio, and then we will open to questions. Thank you.
So thank you, Vicky, and for inviting me. And it's really a fascinating and very appropriate juxtaposition to put public health and economics in this setting, but it's not one that I've previously been involved in this sort of a pairing, but it's very exciting to be a part of this, so thank you. So Vicky had asked that at least from my perspective, the departure point be thinking about the strategies for quarantine and this concept of vertical versus horizontal. And so I think it's worth just touching on what the differences are. And so very briefly, the concept of the vertical quarantine, basically it implies trying to protect the most vulnerable in this sort of a setting. And it really comes down to our concept of vulnerability has basically been driven by who is perceived to be at increased risk for dying, for mortality, and then also serious consequences, so for morbidity. But you really in order to have that sort of a policy, you would need to have a very clear idea of who is at increased risk. And you would have to think about whether the only risk that matters is the risk of dying, which is an easier one in the short term to be able to quantify. The risks for long-term sequelae, we still don't know. The definition of who's at, well, actually, just to go back, so that would be the vertical quarantine is where you're selecting only, you're only going to try to isolate those that are perceived to be at high risk for dying. And in a horizontal one, you're going to have the entire population basically be sheltering in place as much as that is possible. And that's something else I'll come back to. So the concept of who's at increased risk for mortality, to even think about a vertical isolation quarantine strategy, really our understanding of who's at increased risk for death has been evolving as the infection and the disease spreads globally. And we're learning constantly. And part of it has also been recognizing that certainly there has been a lot of work that's come out incredibly rapidly from China. It's incredible the number of publications that have come out in a very short period of time. But it does seem that some of the realities seen in China do seem to hold globally, but some of them we've been learning that the situation in Europe has not always been the same as expected or anticipated based on what had happened in China in terms of the perception of who is at increased risk. And I think one of the really important concepts that I think we've learned here, we had the early warning signs already in Europe, is that not at increased risk doesn't mean that you're not at a zero risk, or that not at increased risk doesn't mean a zero risk for severe disease. And so I think one of the big surprises that we've seen here and in Europe as well is just the sort of the unexpected amount of morbidity of seriously ill younger adults, young, quite youths, almost older teens that have not been as immune as was thought. And that's had major consequences, but in terms of the demographics of the region, that's an important thing to keep in mind. And that the cost of death may not be the only severe cost. If you have segments of the population that are an important number that are seriously ill, that may also have large economic consequences down the road. Additionally, we're recognizing that there are certain coexisting conditions which unfortunately may be prominent in some countries of Latin America. So there's this possible increased risk in subsegments of the population associated with obesity, diabetes, to a lesser extent asthma. Clearly, those are major problems in several countries in the region. So that extends beyond just thinking about the older segment of the population, which has been the traditional sort of at-risk classification. So once you start to factor in who is at risk, and I know right now there is a lot of discussion happening in Europe precisely on peeling back the horizontal quarantine to just those at risk, but then when you actually start to think about all those at risk, increased risk from those that smoke, really you start to see that having this kind of a vertical quarantine would actually be much, much harder to enforce, and really would risk ostracizing many segments of the population. So a very challenging aspect to consider. Another thing that we can try to learn from, one of the advantages for Latin America is the fact that we've had more time and have had the benefit of observing what's happened as the disease has traveled. And there are some differences. There seem to be some variations in the mortality, and clearly we've been seeing the examples of the overrun health systems, Spain, Italy, and New York, versus other countries that have had not so easy to explain very low mortality, such as Germany, which is basically the main example of the outlier. And other aspects that we need to consider in thinking about the horizontal, vertical, and economic consequences of these quarantines is that we're also having an evolution in our understanding of the early symptoms. You know, initially it was thought it's fever, cough, shortness of breath, but as time has gone on, there's been an increasing appreciation of other other symptoms, which are much harder to classify. So gastrointestinal symptoms, which can have many other etiologies. Now an understanding of some very complex neurologic symptoms. So you start to realize that there may be a very large group that hadn't been recognized, that had not been defined as being symptomatic. And so realizing that also means that the concept of quarantining somebody who's symptomatic and saying they should self-isolate becomes more complicated as you start to add on all of these additional symptoms. And that's certainly going to also affect the estimates of long-term costs, because you need to think about not just respiratory consequences, but additional complexities in terms of side effects that may happen and what those may mean for long-term follow-up of the portions of the population that are affected. And tied to all of this is certainly the challenge of the testing and of deciding really who to test, with what test. Would you test for presence of the virus, or do you start to be able to test for who's already been exposed and is immune? And do you have a way to test that somebody is not just immune right now, but has a lasting immunity? And so these are all evolving. Some of those tests we have, some of them, unfortunately, for all sorts of different reasons, we don't have them available. Even if there's the technical abilities, there's not the availability to really have them mass produced for the populations that are needed. And then there's also an evolving understanding of the mechanisms of spread. And so that has a big implication for how you do this social isolation, this physical distancing, the recognition that the 6 feet that we're all doing here, or 2 meters, which is not what the WHO is saying, but even 2 meters may not be sufficient, with an understanding that now there is an increasing recognition of the possibility of aerosolization, especially in healthcare facilities. So that also makes the concept of thinking about just isolating those who are symptomatic and those that are at highest risk, that becomes much more complicated. And what I haven't mentioned, but which is really key, is the fact that there's a very important part of the population which is thought to not be symptomatic, or to have very mild symptoms, or to have symptoms that actually haven't been identified as being related to COVID. And that makes it particularly challenging. And one of the populations that is particularly at risk, shall we say, for being asymptomatic is the pediatric population. And that's a large segment of Latin America, and particularly children are a big part of populations or groups that tend to live in close quarters, and where this isolation is a nice idea, but it's hard to get it beyond the theoretical. So one of the main things is really that quarantine measures have been based on a very early understanding of how the virus spreads, how long it incubates, but they need to be constantly readjusted, which makes it very hard to sell a public health message. But that's the reality, is that as we understand more of spread, of how the virus is shed, how long it how long the particles are able to remain infectious on what surfaces, and who is the carrier that's asymptomatic, that's continuing to evolve, and that's going to have implications in terms of how we can be more effective and potentially efficient in the quarantining. So in terms of just thinking for Latin America, in addition to the potential consequences of the sheltering in place, one of the other parts that I do want to mention is that what happens in a healthcare emergency, or even in preparing for it, is that it's necessary to really shift all your efforts in healthcare to focus on this potentially major onslaught. And there will be implications later on for all the things that get put aside, that don't get taken care of. There are certainly, some possibilities that air quality will improve, and that's going to have some benefits in public health and chronic diseases, fewer car accidents if fewer people are on the road. All of these are things that are being seen in multiple places, but there are clearly, there's a lot of healthcare that's being put on hold in all the places that this is hitting, and there's not a reason to think that that won't happen. In Latin America, the places that are preparing have identified centers that are going to become COVID centers. And once you become a COVID center, it basically means you stop taking care of everything else. But all the other patients still needed their care. It just has to wait. And what the costs are of catching up with all of that later on is something that probably also needs to be thought about. So just a couple more points that I think are relevant for thinking about Latin America is certainly the challenges that probably everybody on this call is aware of, that you have this tremendous population density in the mega cities. So really social isolation is, or the physical isolation is very hard to institute. The large reliance on the informal sector, which is particularly vulnerable, and then the obvious that there's the challenges of limited access to water, which makes hand hygiene impossible. And these are particularly heightened in displaced and migrant populations, which are unfortunately present throughout the hemisphere, both the internally displaced and migrants, the international migrants. And so that's another very vulnerable population that needs to be thought about, because this ends up, if it affects one population, it obviously has large risks for sharing. And lastly, the variable decentralization of the healthcare systems makes it even more challenging, I think, overall. As a region, there's been tremendous resourcefulness in approaching the crisis, but there are clear shortages, at least in some countries, of specialized personnel. Mexico has had a very interesting but very rushed approach to online training of their large population of recent graduates, and a very clever incentivizing with points to facilitate recent graduates who want to enter into specialty training, which is usually very hard to obtain, that by basically helping out in this crisis, this will make it easier for them to be able to do the training they want. And so that's a very interesting approach. But along with that is that there's also, unfortunately, reports of vulnerability of healthcare workers at the very moment that they're being asked to take on risks, and episodes of discrimination out of population level fear. And those attitudes, if they become widespread, can have devastating consequences. If you don't have an engaged health sector population, it's the thinking about what the repercussions will be are just horrifying. On the flip side, though, are big advantages in Latin America, is that there's relatively large and well-equipped medical scientific academic community, and they've been participating in the global efforts to innovatively prepare measures, and particularly thinking about ones that will work for the realities of Latin America, including strategies to detect immunity and molecular and populational approaches for documenting exposure. And so that's been happening, and it's wonderful to see. And very recently in Bogota and Medellin, they have successfully isolated strains of the virus and been able to show that actually there are at least 2 different strains in Colombia. What that will mean in terms of clinical repercussions is, I think, not yet known. But in any case, there's clearly a lot of scientific activity happening in the region which is very exciting and wonderful to see. But there's going to be a need for regional strategies for cooperation that's going to be critical, at least on the biomedical side. And I'll stop there.
Thank you very much, Manuela. We have many questions that I will ask after Jose Antonio talks, but many of them deal with this issue of the tension between the economic and the health consequences of the quarantine. So I think better to start with Jose Antonio for 10, 12 minutes and then go to the questions.
Well, thank you, Vicky, for the invitation, and thanks for being with so many of you. I hear participants 225. So this is, I guess, a significant meeting. Let me start by making a very strong point that one of the problems that Latin America faces in economic terms have to do with problems that were already present before the coronavirus crisis. The first one is that we have gone through 5 years of very slow economic growth, and the expectations of acceleration growth were actually quite limited for this year before the crisis. And that in turn had generated a break in the tendency of poverty reduction. Actually, according to the ECLAC estimates, poverty has actually been increasing in Latin America over the past 5 years. The second is that the fiscal space that countries have is very limited. Particularly if we compare to 2009, or excuse me, 2007 or 2008, that is before the this thing that's called the global financial crisis. For example, that's just in terms of debt, public sector debt. The public sector debt in 2008 was 40% of GDP. In 2019, is 62% of GDP. So, and actually, on top of that, there are deficits, and some countries have serious problems. I'll come back to this in the future. On top of this, let's say mediocre performance, or as I have called it, the lost half decade that we had undergone, we have the additional shocks. The additional shocks are, first of all, the trade shocks, which are the commodity prices, notably in oil and minerals, and the difficulties faced by all global value chains, which is important for the manufacturing exporters of the region. The second are the financial shocks. We have undergone in the last couple of months through the worst outflow portfolio capital from emerging economies in history. We have, of course, had previous debt crisis, capital account crisis of different character, but portfolio flows have become a major source of financing of Latin America since the global financial crisis, and now they are going out at very fast levels. And this is associated also with the increased cost of financing of private capital, from private capital markets. They have increased on average about 2 percentage points in the last years, and of course for some countries have become prohibitive, particularly Argentina and Ecuador. And last but not least, in the financing, the credit rating agencies are doing a horrible job downgrading some Latin American countries at the worst possible time. And finally, we have in terms of shocks, we have a question mark of what is going to happen with remittances, which is of course a major source of financing for several countries. Well, in terms of trade, I guess I should have mentioned the case of tourism, which has collapsed altogether. This is not as important for Latin America, but it's of course, except for a few countries like the Dominican Republic, for example, but it's more a problem of the Caribbean in the region. So these weak conditions plus the additional shocks is the background for the of course the shocks that have generated by the health crisis associated to the coronavirus. Now, the basic, I would say the the coronavirus, of course, generates in economic terms a lot of problems. Let's say the demands for financing. I'll come back to that. The health system needs additional money. Latin America has relatively low capacities. A large part of the population has no access to health services, et cetera, et cetera, et cetera. But I would say, in particular, the very strong shock that we have is associated with the lockdowns. Particularly, I guess what Manuela called the horizontal quarantines, which an increasing number of countries or increasing number of cities in some countries have been using. There is not a very precise estimate of how much the economy is affected by this. I've seen some OECD estimates for the OECD countries, and they basically indicate that between 25 and 40% of economic activity is totally interrupted, which means that the GDP in the, let's say in the second quarter, for example, for developed countries, may fall, according to many estimates, by something like 20%, which is unprecedented in history. For it's really a sudden stop of a magnitude that we don't know. We have not known. So the real point, therefore, is to what extent managing the health effects, you can actually move into a different kind of a lockdown, which could be a vertical lockdown, or as what at least in Colombia has come to call an accordion lockdown. So you interrupt it and take it back depending on what you see the effects of the lockdown are. In any way, the global recession that we're going through in the whole world is associated to this particular problem. And when we think what is the critical issue from the economic point of view, is how long the adjustment of the health system is, how long it would be in order to be able to manage this particular effect. Which has to do with, of course, with the capacity to create more capacity, more beds in the hospitals. Very importantly, and perhaps most importantly, the massification of tests, and of course, in the medium to long term, the discovery of a vaccine that will solve the problems. But I think the issue of how to manage the lockdown is a significant problem. And let me say, what are the different policies that, the different shocks that you have and how to manage them. The first one is the shock on household incomes, unemployment. Now, this has in turn two different dimensions. One is for the wage workers, which in most Latin American countries have some levels of protection. Unemployment insurance is unfortunately available for very few countries, but at least you have rigidity in firing workers, and therefore they have the opportunity to delay some of the employment effects. So for me, the most important shock in this regard relates to the informal workers and the independent workers, which have no protection at all. And I must say, I'll point out in a few minutes, there are actually no policies for them, except perhaps in a couple of countries. The second is the possibility of bankruptcy of firms. small firms, but also large firms. This is, of course, a very important issue because the survival of firms is the essence of the background for the recovery of the economies. When you have a large number of bankruptcies, simply the firms will not be there at the time of recovery. And of course, if this problem is large enough, you may end up having also a financial crisis, a domestic financial crisis, okay? And the third major issue is the fiscal sustainability. How much money you need in order to expand the health system to face the crisis, but also how to manage some of these other effects that I have just mentioned. Now, the policy that have been adopted, in a sense, have been of four issues. The first one is the health policies to expand the capacity of the hospitals, the massification of tests, or getting the tests to be able to massify them, and then some other research that is going on that may lead to some of the solutions, let's say, in the health area. This is something that every country is doing to some extent. The second issue is the protection of incomes. In that regard, I must say the conditional cash transfers that many countries have been used to protect workers, and particularly poor people. But there is nothing that I know of a protection of independent workers or on a large scale, and particularly informal workers. I think the base case is probably the basic income policy that was announced by the Brazilian government. And then in other countries, you have been expanded the conditional cash transfers to get the vulnerable population that is not necessarily poor. For example, a good example is actually in Bogota, where the mayor of Bogota is adopting a policy to protect the vulnerable population that is not necessarily the poor. The third issue is liquidity. This is perhaps the area where there has been more advance in terms of basically central banks providing liquidity lines in order to avoid the, let's say, liquidity crisis. And this may be associated also with a reduction of interest rates by central banks, which has been now fairly widespread. And the fourth issue is financing and the guarantees on financing. These are basically credit lines. The base mechanism in this regard is to use the national development banks where you have them in order for them to provide or public sector banks, let's say, for countries that don't have a development banks as such, in order to provide additional lines of credit, some of which are subsidized and aim at not only at avoiding bankruptcies of all types of firms, but actually also as trying to protect the employment of those firms. So you can, in a sense, have some subsidy requirement which is associated to the protection of employment. Now, finally, in the fiscal area, we have a significant amount of problems for the reasons that I have already mentioned. The fiscal packages are relatively small. When we're talking in developed countries or packages which are in the order of 10% of GDP or 15% of GDP, the largest in Latin America I've seen is the Chilean one, which is about 5%, but Brazil is about 3%, but most of the fiscal packages are in the order of 1.5 to or 1% of GDP, which are really small and probably insufficient. And then, of course, the question of financing. Who is going to finance the deficits, which are going to increase not only due to the additional spending, but also to the to the reduction in tax revenues that are going to take place because of the crisis. And then, of course, all multilateral development banks have moved into the direction of creating new credit lines, facilitating existing credits to be used for health purposes or for any other emergency. But it is unclear whether the size of those programs will be enough for the current conditions. So the discussion is also going on about to what extent central banks can become a source of financing of governments. Not necessarily directly, but buying treasury bonds on a large scale. And so they say the government issues treasury bonds and the central banks buy an increasing amount of those treasury bonds in order to facilitate the financing. Let me say finally that that there are many discussions about what is the magnitude of the crisis that Latin America will face. Let me, in that regards, say that all the world estimates have been reduced. Worldwide, for example, now there is a recognition that there is going to be a fairly universal recession in the world. The GDP will be falling, that even countries that had relatively strength like the United States may have contractions of GDP of around 3% this year. So for Latin America, I think the discussion is still open as to what is the extent of the, we have no estimate by the Inter-American Development Bank, no estimate for the World Bank or the IMF. We'll have the IMF estimate next week for sure. So the only estimates are those of ECLAC, which put out estimated a reduction of 1.8% this year. I think this is a significant underestimation of the crisis. Goldman Sachs, for example, has already estimated the contraction of 3.8% for Latin America. And I was this morning in the conference of the European Investment, the Economist Investment Union, and which estimated a reduction of over 4% of GDP. If these numbers are correct, the Goldman Sachs and the Economist Intelligence Unit, Latin America will actually be one of the worst regions of the world, not probably as bad on average as the Euro area, but relatively bad. And some countries are going to be hit very fast. For example, and I will end with this, Goldman Sachs, for example, estimate that the GDP of Ecuador and Argentina will fall more than 5%. Mexico and Brazil around 4%, or Brazil 3.4%. And Chile, Peru, and Colombia something between 2.5% and 3%, which are in a sense the best cases in the region. So this is an unprecedented crisis. We have never been in a mix of not only of really bad economic conditions, but also of this of the effects of the coronavirus, in particular the effects, as I pointed out, of the quarantines. Thank you.
Thanks to you, Jose Antonio. And I want to repeat to everyone that was not here at the beginning, because some of the questions brought issues that are answered by the podcast that's in our website with Silvia Martins about variation across countries on quarantine policies. So I really recommend to go there. And I'm going to start with a question that brings some of the questions that I've been gathering together, which is the issue of the informal sector. I think a lot of the people have really brought to the fore the fact that the informal sector is a real big part of the Latin American population. And it's a sector that requires special policies, not just income policies that, have been put, in a not systematic way by many countries, Chile, Argentina, Paraguay. I mean, I'm reading the comments here, but also that face a lot of health limitations on how to deal with quarantine and how to deal with the fact that they might be the first to fall in terms of being sick. So I would like to have the same question for both of you of what, to start, what are the policies for the informal sector that can be done to deal with both the economic and the health conditions that they're facing? Manuela, you want to go first, and then José Antonio?
You have to unmute Manuela.
Yes,
Okay.
yes, I'm sorry, that's me. I'm happy to go first, except that I think that the answer to this is actually probably not a health answer. I think the best answer for the informal sector is to enable them not to have to work. So I actually would throw back to say that I think that is an economic answer.
Okay,
That's
fair enough. José Antonio?
You have a health issue, which is access. Okay, access to this population, because they may not be covered unless you have a universal health system coverage. For example, in Colombia has universal health system, so everyone is covered. But there are countries in Latin America that don't have universal health, and I guess one of the issues that must be introduced by everyone is you have to have universal health by people affected by the virus. Now, in economic terms, there are two things that are important. The first one is how to do income support. And as I said, some basic income policy, Brazilian type, may be required under the current conditions. Which means that you have to go beyond the conditional cash transfer, which are for the poor, in order to provide the income support to a broader set of population, at least for a few months, let's say, during the crisis. I think this is probably now how to design that. In Brazil, I think it's much easier because Brazilians have developed this system for a long time. But in other countries, it may be difficult. As I say, for example, in Bogota, the mayor, which is on top of this policy, is trying to solve the issue of access to these these additional transfers. The government of Colombia yesterday launched a small, more universal income support. But anyway, and the other issue is, of course, employment. But the issue of employment is actually a question of the end of the quarantine. Without the end of quarantines, there is no work for informal workers. Unless you have special programs. For example, one of the sectors of the economy which is doing relatively well is house delivery of food and other things. So you can actually expand house delivery, and actually many people which are probably from the informal sector, are starting to work in home delivery. But beyond the crisis, beyond the quarantine is the only solution for most of the informal workers. And that's why the quarantine actually has a especially strong effect on the informal workers.
Yeah, just to add the comment that I think the challenge is that precisely just the fact that the informal sector can expand into these areas such as delivery, unfortunately that gets back to putting this very vulnerable population at risk. And so then the question is, yes, definitely the universal access, but I don't know what the possibilities are of the countries that don't have a universal access to say, in this particular setting, I think it's really important that people not go to work or not be working when they're ill. In order for them not to be doing that, there has to be a real incentive for them not to do that. So maybe compensating in some way when you're ill, an additional economic compensation to not work. I don't know if that could work, but ultimately what you want is to minimize the risks to the population to the rest of the population, and then you want to minimize the risks as well to that population if they're going to be not subject to the sheltering in place. So I think it's the ideal situation is still for the minimal number of people to be out, and for those that are out to be really well protected. So then the solution would be one of ensuring that there is protective equipment that is actually functional for those that are going out to do food deliveries, particularly something that is a real avenue, a potential avenue for spread.
Yeah, let me say a couple of things. There's a comment that I think someone make on the chat that is worth bringing. The fact that there is universal healthcare in many countries of Latin America, that doesn't mean that everyone has access to that healthcare. The resources are pretty scarce, and if the crisis hit, we will see the level of scarcity. Yeah. And in general, the access to those scarce resources is pretty biased by class. And so that brings the issue of to what extent the governments can coordinate private and public resources. You know, many countries have both and even more than two systems. And these bring us to two questions, I think, that are difficult to deal with the government. For the governments, one is the degree of innovation. I mean, where you said we need to pay for this, it's not clear. Many governments are paying with printing money. So, I mean, heterodoxy is back to the fore to bring the question to Jose Antonio, and that means also some governments might take much more interventionist measures that they had in the past. And to Manuela, I think another question that's asked here that pushes your take on the vulnerable informal population even more is what to do with migrants. Mm-hmm. That's the Venezuelan migration, tons of people, and I haven't seen, honestly, any policy directed. I mean, there are policies to the informal sectors and income policies, but I haven't seen any policy directly, specifically to the migrant population. So I guess back to you guys.
I guess just on the last one, I think that's a global concern. I mean, the migrant crises are global issues. I am also not aware of policies that are specific for the migrant populations, but I think along with the migrants are the internally displaced, which in some countries like in Colombia have been a long-standing issue. But I think it ultimately it still is the issue of the migrants is the same as the issue in any of the mega cities in the more marginalized areas. You basically have a situation of crowding where the distancing that would be important in order to avoid virus transmission is just not possible, and there's no water access. It's just the situation is magnified and compounded, but it actually comes down to those basic issues, and then the lack of access to healthcare. So I have not seen initiatives. I know that there's at a global level from UN, from other organizations, a request that this be considered, but I think the implementation of how one would be providing services, providing distance to those in transit, and I think actually the in transit is one, but more challenging those that have settled in very crowded areas is a huge issue. And a ticking time bomb, but I haven't heard any creative solutions.
Let me say that this issue of access to health services is, of course, important in terms of the quality and not only the quantity, the same. So even in universal systems like the Colombian one, it's quite clear that the poor and the rural population, for example, will have more problems of access if they get sick, which is, of course, an important problem. But let me say that this is also true of other issues. The issue of education is very important because, virtual education works when you have computers. Now, it just happens that even university students in Colombia, I've heard there are some university students that don't have computers, personal computers, and therefore, and not to say primary school. I mean, poor primary school students. Who the hell is giving them access to the education? So this is a significant problem that we are facing. So, and that's why actually many people have argued, and it's probably correct, that this crisis is accentuating the effects of inequalities in Latin America and in the whole world. I think this is an important question. I mean, migrants, of course, are a problem. You can say in principle in Colombia, they have access to the health system, for example, as well as to the education system. But still, you know, again, many of them probably have a very limited access in de facto, let's say. And in Colombia, there's a huge discussion about the repressed migration from Venezuela that may happen at one point. If the crisis in Venezuela and in the health system really collapse, I mean, the health system collapses, which it probably will. And then whether Colombia can manage a massive migration of sick people coming from Venezuela. It's a real problem that is being discussed in Colombia. In terms of financing of the public sector, let me say that in the whole world, central banks buy government bonds. I mean, large part of the package approved in the United States is massive deficit of the central government, financed by issuing treasury bonds, and the Fed buying lots of treasury bonds. So the whole world, the central banks finance governments through that mechanism. So I would not, I don't think we should discard the possibility that the central banks of Latin America will be more active buying government bonds. I think that's one of the main mechanisms that that have to be done. I don't like direct lending by central banks to governments. I think it's better to do it through treasury bonds, which actually allows a much better management of monetary policy in the future, because then you can buy and sell. Well, you can sell actually government bonds that you have bought during the crisis, which is something that all central banks did, let's say, after the 2008-2009 crisis in the developed countries.
Okay, there's been a series of questions on the utilitarian trade-off, I want to call it somehow, in the need to loosen up the quarantines because people who might not die of coronavirus might die of hunger. I think different people have written the question in different ways, but that there is a trade-off there that policymakers will have to face. I think Hausman had made the point among others, and that's a very tough one. And so what do you think would be the conditions or the factors that policymakers should look at across the region when making these decisions of, whether to extend the quarantine at the expense of people who lack food on the table, or, what are the risks in terms of getting ill? And I'll, let it back. I mean, maybe you, Jose Antonio, first, and then Manuela, and this might be our last question. We're almost getting to the limit of time.
Well, this is a basic question. Actually, when you were saying that there was a demonstration here in Colombia, and the people demonstrating had big signs that said, "We prefer to die of flu than die of hunger," which is exactly what you were saying. I mean, many people, many informal workers, and have absolutely no income, and they are poor. I mean, they're necessarily very poor in some cases, but they are poor. I mean, people who have minimum wage working in restaurants, for example, and they have no income because the restaurant closed down and fired them, let's say. But also people who were street sellers in all in major cities. So it is a major problem. At the end of the day, I think there has to be an agreement between the health authorities and the economic authorities about how to loosen or when it is possible to loosen the quarantines. Whether you can go from horizontal to vertical quarantines, to use Manuela's terminology, or when you can have this thing called accordion quarantines, or whether you can have more intelligent quarantines, which is a term that the president of Colombia used on Sunday. Anyway, so there has to be a continuous dialogue, but the strong view of some health experts that actually are asking the world to be on quarantine for 3 or 4 months, that is economic collapse. I think there will be, in terms of income, of hunger, but also of firms. How many firms? And actually, for example, good entrepreneurs of Colombia say that they can survive by paying the older workers for 2 months, but it's unclear whether they can go beyond 2 months. There was a survey, for example, in Cali among entrepreneurs. About half of the entrepreneurs said they can keep the employment of the workers for 1 month and the other half by 2 months. But beyond that, you actually have a real economic problem. And the subsidies that you have to provide are of a magnitude that are probably not easy to finance. I mean, I know there's some developed countries that have been very ambitious in this regard. Let's say I've heard Denmark, for example, the government is saying paying 75% of the wage bills up to certain level of wages of workers. But I'm pretty sure no country of Latin America can do something like that.
Manuela?
I mean, I think it's very challenging, and in many ways it ends up coming down to ethics, because it comes down to deciding, this is an extremely transmittable disease. There are large portions of the population that are going to be at risk. So apart from overwhelming the health sector, which has been a big part of this, what we've all now become very familiar with, is wanting to flatten the curve, but there's also really a realization that there is going to be important mortality, and to the extent it really comes down to the more you're able to spread it out, particularly in settings where you don't have enough health care that is sufficiently trained to be able to handle the very challenging sequelae of this infection when it goes badly. And unfortunately, we still don't fully understand everyone that's at risk for those sequelae. But if you allow that segment, that part of the health sector, to be able to handle the disease, then you're going to be able to get more people through it. And unfortunately, the population that is likely to be at greatest risk for hunger is also more likely to be the population that is actually going to have a worse time getting through this disease. So it's a really tough one, and it really comes down to an ethical decision. I think that Denmark actually, and maybe from what you were saying earlier, maybe Colombia stopped things early enough that part of it is, if you stop it early enough, it seems like Denmark is already thinking about starting to reopen some things, and right after Easter. And so one of the issues is, if you started the isolation early enough, then maybe you have more of a chance of selectively being able to restart some of the economy. I mean, nobody's done it yet, but that is certainly the plan in Denmark, but they can even consider it because they took dramatic steps very early.
Thanks very much. The audio, it will be posted in our website for those of you that have been asking on the chat room. I'm sorry I didn't get time to answer all the questions. There's more webinars coming, one a week, And some of the issues that you have asked are going to be taken in the webinar: the issue of the educational divide with access to remote education, the weakness of the state, the issue of data and which data and evidence to trust in analyzing this crisis that we're living. I invite you all to go to our website. There are links there that provide more information on COVID-19 in Latin America. And I want to thank you very much, José Antonio and Manuela, for giving us their time and their expertise in this time, and to all of you for having attended the webinar. I'm glad this time it works. Hopefully next time we'll manage the small technical issues at the very beginning. Okay, thank you very, very much.
Thank you to you, Vicky, for organizing this.
Thank you.
Thank you.